好，歡迎大家出。
Welcome to today's briefing. The advisory panel on COVID-19 vaccines held a meeting this afternoon. The convener of the advisory panel, Professor Wallace Lau, and Professor David Hui, will be briefing you on the details. Professor Wallace Lau. Right, let me first brief you on the objective of today's meeting, our deliberations, and the outcome. I think we're all clear that in early January, the government received the first application of COVID-19 vaccine for approval. As we all know, this is made out under 599K, that is Prevention and Control of Disease Use of Vaccines Regulation for using the vaccine in Hong Kong. And this is mRNA vaccine called Community COVID-19 vaccine, or BNT162b2 vaccine, co-developed by BioNTech and Fosun Pharma. We all know that BioNTech is a German developer, and this afternoon the advisory panel held a meeting to discuss the details. In the meeting, we deliberated on the safety, efficacy, and the quality of this vaccine. We scrutinized the relevant documentation and the details therein, for example, the phase 3 clinical trial details, and that it has a 95% efficacy rate for users above the age of 16, and also the overall situation of vaccination in other countries, and whether there are any, or the proportion of serious and adverse effect cases. We also considered the technical standards and see if the developer meets the GMP standards, and also other details relating to clinical studies. We also looked at the primary evaluation and approval by overseas competent authorities and other considerations. Number 6, we considered whether the applicant will follow up after launching of the vaccine by way of surveillance and monitoring. So in the light of the current epidemic situation in Hong Kong, we recommend the use of Comirnaty as the COVID-19 vaccine in Hong Kong, considering the positive benefit-risk profile. The advisory panel will be making recommendations to the Food and Health Bureau for consideration. To enhance transparency of information, the advisory panel will also publish our expert advice and recommendations in the public domain, and the relevant paper will also be uploaded to the Food and Health Bureau's website for public access. At the same time, the advisory panel also attaches great importance on the possible adverse effects upon inoculation and how we should go about with surveillance. We understand at the time of meeting that the Department of Health has just set up a new committee, and that is an advisory panel on the assessment of COVID-19 related incidents. So after inoculation, if there is any incidents in the community involving serious or adverse effects, the advisory panel will be looking at these incidents. I understand that the panel will comprise academic professors from tertiary institutions as well as medical experts. There will be experts from hematology, from the epidemiology, etc. Finally, we want to ensure that the vaccines will be safe for use and also they will be effective and they will be of quality. The panel, therefore, will be imposing conditions for the applicant to continue to submit the latest clinical data, an update on the safety report, as well as the relevant quality control documents per each batch of vaccines produced. If, in the opinion of the advisory panel, the risk of being inoculated outweighs the benefit in the community, we'll definitely follow up the matter with the Food and Health Bureau in an appropriate manner. By appropriate, that means revoking the use of vaccines or the approval. That concludes what we have discussed today. Now the floor is now open. Please state the media organization you represent.
The reporter in the brown jacket. TMHK. Regarding the safety of the vaccine, earlier in Norway there have been some cases where patients who have been inoculated with the BioNTech vaccine, 30 elderly patients who have chronic diseases have passed away. It is expected that they pass away because of that. Did the panel discuss this point in its deliberation? And what is the risk assessment process? And in view of these reports and incidents, would you recommend to the government that for patients of certain age groups, it's not suitable for them to be vaccinated with this vaccine? And regarding the local, infection situation, we have more than 100 cases. It's particularly serious in the Yaoqing district. Will the professor suggest that people living in that particular district should be vaccinated with should be inoculated with a vaccine? And would you recommend lockdown for the people living in that district? The main purpose of the briefing today, of our discussion today, is to assess whether or not the benefits outweigh the risks in respect of these vaccines, and then give our recommendations to the Secretary for Food and Health. Of course, we also discussed the different possible adverse reaction side effects of the vaccines. We do need further information in the light of the mortality in Norway. We will attempt to obtain from the regulatory authorities for the latest information from Norway. Overall speaking, we found that if we look at all the available data, we are of the opinion now that the vaccine will provide more benefits to the public than the possible risk that there may be. So we would therefore recommend to the Food and Health Bureau that we should use this vaccine. As to which type of patients or persons we should be particularly careful, that was not the subject of a discussion today. But we understand that the Center for Health Protection has two separate, panel of scientists who are following up on these issues. Professor Hui. The panel of experts also discussed the priority groups to be vaccinated, including the staff working in elderly homes and those working in hospitals, elderly people over the age of 60, and people with chronic diseases. We have to wait for more information from the health authorities in Norway, and after that we will make a decision as to which category of person is suitable for vaccination by a particular vaccine. And we did not discuss the issue today regarding your second question, but there will be a separate press briefing regarding the outbreak in the Yaoqing district later on this evening. I think the briefing today is basically about the subject of the vaccines. Any further questions? Hi, Apple Daily. In Norway, we now understand there are now 29 mortalities, 13 of which have to do with the side effects of the vaccine. The chronic disease deteriorated and the patient passed away as a result. For the time being, according to your assessment, for people with chronic diseases and the elderly who are frail, would you continue to recommend that they be vaccinated? Will there be any priority in terms of the age brackets to be awarded different priorities? Some experts say that the side effect for the second dose of the mRNA vaccine will be stronger. Have you considered whether or not the risk will be smaller if we take if we opt for the biotech vaccine or the coronavirus vaccine? And also, let's say if you have 1,000 people vaccinated, let's say how many people would need to have side effects and how serious will these side effects will be? Would you decide that we should stop the vaccination of that particular vaccine? Regarding the question of the 13 and the 29 cases, we did discuss this today, but as I said, we hope to obtain more information and whether or not there is a batch of people or cluster of people for which we will give priority or less priority for them to be vaccinated. That will be looked at in detail by the two panel of scientists as to whether or not we should opt for the coronavirus vaccine. Today, our focus is on the biotech vaccine, and the committee did not have detailed information regarding the coronavirus vaccine yet. Or the question regarding timetable. I also like to add that regarding Norway, 42,000 people have been vaccinated. There have been 29 mortalities, 23 of them were over the age of 17 with chronic diseases. We're still waiting for further information. Regarding the coronavirus virus, we don't have any information yet. I understand that the vaccine, the biotech vaccine, will arrive in February, and we're waiting for the Bureau to decide when we can start the vaccination. Next question.
In terms of Norway, there is a growing number of fatalities related to the Pfizer-BioNTech jab. At least 29 elderly recipients have died as a result. How does that? Or have the experts discussed on this issue, and how does this affect the recommended priority of groups taking the vaccine first? And secondly, are there any clear expected timeline for the vaccine arrival and the rolling out of the program? And lastly, in terms of the chance of recommending to cancel the approval, risk being higher than benefits, how would the experts define this? Thank you.
Maybe I will reiterate what Professor David Hui has just said. Actually, according to the information that we have got in Norway, up to 42,000 people have actually received the vaccine, of whom we actually reported 29 deaths, and out of the 29 deaths, 13 so far as reported actually have been suggested to be probably related to the vaccine. We still need more information and more data from Fosun actually on the causes of death of these 13 persons. Okay, we understand that they were all elderly. We understand that they had actually multiple what we call comorbidities, multiple different medical conditions. We need to know whether the deaths actually was related to the underlying problem or to the vaccine. So we are actually asking for more information. We will also be approaching the regulatory agencies in Norway for such information. Hopefully we will get those. As far as arrival timeline, I don't have the specific information, unfortunately. And whether when we will recommend the Food and Health Bureau to perhaps stop the use of the vaccine, I think it will be very difficult to say here, actually, what are the clear definitions, etc. It really depends on the overall efficacy, the benefits of this vaccine to the population of Hong Kong, and the possible side effects that we will encounter later on. But the panel actually will convene as soon as we actually receive any information suggesting of perhaps a tipped in the balance of the benefit risk ratio of the vaccine.
其他提問，綠色衫呢位。
Next question.
Hi, I'm from Now TV. Have you checked the Australia's problem regarding BIOS policy? Will there be any exchange of information with the Australian counterparts? And just now you mentioned you haven't sought information from the Norwegian authority. Does it mean that you have not considered the mortality risk before arriving at this decision? Why don't you include this information as well? And at the meeting just now, how many members agreed with the positive benefit risk profile and voted in favor of the emergency approval for the vaccine? Now, the last question that you put pointed out exactly the purpose of our meeting. The purpose is to assess the benefits and risks of the vaccine, whether the benefits outweighs the risks. Now, for some particular incidents, as we have received reports from Norway and Israel, we'll look into them in a greater detail, and whether recommendations should be made. This should be something to be overseen by the two advisory panels. About the side effect of facial paralysis in Israel, we looked at the figures. Facial paralysis or Bell's palsy is not really a rare condition. Every person is prone to facial paralysis. We're looking at the situations around the world. In some places, after inoculation, there may be an increase comparing to the background or base rate, but then we need to look at the whole picture in a greater detail, and all in all, whether vaccination brings more benefits and risk to our community as a whole. The speaker is not coming through. You mean in Norway? The speaker is not coming through. The speaker is not using microphone. Yes, we included that. We discussed not only phase 3 clinical trial reports, we also discussed the data available since the release of the phase 3 clinical reports, including the data of vaccination in various countries. Next question. I'm from Hong Kong 01. First, about this decision endorsed at the meeting, may I know exactly how many members voted in favor of the application, how many against? And about approval for emergency use, when will this be announced to the public? Second question about the data to be sought from the Norwegian authority. What information are you seeking? Is it autopsy reports or the reports of deaths after the disease had been inoculated? Is there a deadline, or is this an endless wait? And after granting approval for emergency use, does it mean that we'll be paying Fosun Pharma? And if the side effects proves to be more serious than what happens in Norway, does it mean we can get a refund? And if a similar situation in Hong Kong arises, will there be an a mechanism for calling this to a halt? We have altogether 12 members sitting on our advisory panel. We had a very detailed deliberation just now. All 12 members made the same recommendation to the Food and Health Bureau in unison. Now, let me explain the procedures in greater detail. We've just had a meeting, and very soon we will be preparing a report for submission to the Secretary for Food and Health. The report will be circulated among the 12 members of the advisory panel, and only when we have the agreement will we be submitting the report to the Food and Health Bureau for the report to be uploaded online for public access. About information to be sought from the Norwegian authority, of course, we'd like to have as much information as possible, including the gender, age, underlying history of the deceased, and the relevance of vaccination. But of course, at this moment, I can't really tell you by when they should give us information. But for sure, we will be asking Fosun Pharma for the same information as well. This will be one of the requirements we impose on the applicants. They're required to submit data about making down payments, etc. This is not really part of our discussion. The speaker is not coming through. As I explained in the opening remarks, after the vaccines are put to use, another advisory panel would be overseeing the usage and the data, and if there is a concern, it will go back to our advisory panel for further discussion. So if by then we find that the harm outweighs the benefits, then in view of the dire situation, we'll recommend the suspension of this vaccine to the Bureau. The speaker is not coming through. The speaker is not using a microphone. We impose various conditions when granting approval, including the requirement of submitting data, the available data to us. Next question. I'm from Ming Pao. Good afternoon. Well, we mentioned statistics regarding Bell's palsy in Israel and Norway, and that the figures are not yet available. So why is there a haste approval for use? In fact, the guidelines have been revised in Norway, and those who are terminally ill should not be inoculated. Will there be similar guidelines imposed in Hong Kong? And if there is a recommendation from the advisory panel, what will be the reason? And would you recommend the terminally ill patients not to be inoculated first? And have you looked into the proportion of patients having facial paralysis after inoculation and the reason? Is there a treatment? And about serious allergies, what is the percentage? For the BioNTech vaccine, how many people in Hong Kong have serious allergies such that they are not suitable for the vaccine? And what about the group not suitable for this vaccine? Pregnant women and also other groups? For those with serious allergies and other patients not suitable for the vaccine, the two advisory panels will be following up on this issue. For serious allergic reactions, I think that the information is available to everyone. We're talking about some 11.1 users per 1 million population. That's the report we have received. About facial paralysis, in English, the proper name is Bell's palsy. It's treatable. It's treatable with steroid. So we'll definitely advise other committees, panels, and the Food and Health Bureau to pay close attention to the possible instances of facial paralysis. And we also need to educate users that should such a condition arise, the patient should seek medical attention as soon as possible, and then the survival rate is really high. And we also need to consider the incidence rate. That's 1 per 100,000 under normal circumstances for Bell's palsy, and that's not in a scenario with vaccination. Now we need to consider in some countries the rate didn't increase. So that's not a really consistent observation across all countries. We need to wait for more information.
Speaker not coming through. The two expert committees, upon receiving information from the health authorities in Norway, will take that into consideration and then make a decision. Commercial radio. I'd like to follow up on one point. You're still awaiting, replies from Norway and Fuxing for more information regarding the risks relating to these vaccines. You don't have a full grasp of the whole picture. In the absence of full details, why is it that you are, recommending the use of this vaccine so soon? Are you acting in haste? And also, we heard just now, you heard about the mechanism under which the vaccination will need to be terminated. Given that you don't have the relevant information to help you decide what that mechanism should be, so when will you be able to tell us, clearly what that mechanism is? If you don't mind my repeating myself, today what we discussed was the pros and cons of vaccination. Of course, the data from Norway certainly will follow up on such data. If for a particular category of persons, if the risks for them outweighs the benefits, then we hope that the two panel of scientists will come up with the corresponding recommendation as to whether or not they should be administered such vaccines. As to when we think we can decide whether or not the vaccine is efficacious or not or suitable for use, like I said earlier, we will require Fuxing Pharma to, and after the use of the vaccine is approved, they should submit periodically the clinical data and data concerning the side effects for our reference. We will also require them to set up in Hong Kong, a risk protection scheme so that they can collect the relevant data regarding the side effects of vaccination and a system for the reporting of such, side effects. The Department of Health will also have persons to follow up on people who have been vaccinated and follow up on them. I understand that the Department of Health and the Hong Kong University has a plan, for this. Again, as to when we will terminate the vaccination of a particular vaccine, we will need to look at the risks, and we need to look at it globally. We do not just look at the data in Hong Kong, but the global situation. Next. Economic Times. You explained just now that you are waiting for further information from Norway, and then you will refer them to the panel of scientists to decide, who are the people who can be vaccinated and not. Why don't you wait for the data from Norway and Fuxing Pharma, and after you've taken a comprehensive look before you approve the use of these vaccines, and after you've looked at the preliminary data, you said that the overall efficacy rate is 95% for those over the age of 16. What is the best protection rate for which particular age bracket, and for the different age groups, what is the difference in terms of the efficacy rate? At the risk of being long-winded, the data that we looked at just now were the overall or global data. We were not looking at whether or not the vaccine should be administered to people over the age of 80 or people with medical issues. We were not just looking at that. We were looking at the overall situation. If we discover that for a particular category of people, if there is a risk that we are concerned about, then we would make a different recommendation. And again, we will refer it to the two panel of scientists. The second question, for which particular age group will the vaccine be most efficacious? Well, there's no difference in terms of gender. In terms of different age brackets, the young, the middle age, and the elderly, overall speaking, there is not much difference. Of course, the third phase clinical trial, in that particular trial, I think the oldest subject was 89 years, but there's a very small number of such people in that age group. For those at age 65, compared with those younger, the efficacy rate is more or less the same, around 94-95%. We can now take the last two questions. Any further questions? Over there. The lady in grey, Singtao Daily. Other than Norway, will the panel ask for more information from other authorities regarding the Bell's palsy and so on? Have you set a deadline as to when they should submit the data to you? You say Fusan Pharma. For Fusan Pharma, they will need to submit the data before approval is given. For the authorities in other countries, have you given them a deadline as to when they should submit the data to you before you give the approval? And also, do you have any preliminary thought as to which type of diseases would you set some criteria, that is, if there is a certain number of particular diseases, as a result of vaccination, you will terminate the vaccination, as in the case of the swine flu incident. And also, you will be monitoring the possible adverse side effects. What do you mean by side effects? What kind of adverse side effects will you monitor? Do you have a benchmark laid out already as to which are those adverse side effects that you will monitor? I'll ask Professor Hui to ask the question concerning Norway. Other than Norway, we'll also make inquiries of the German authorities. In Germany, 800,000 people have been vaccinated, and there have been 10 mortalities. Reports from Germany said that these people who die have chronic diseases. But anyway, we'll also ask them for such details. For Fuxing Pharma, they have an obligation to provide such information to us. They will also help us, collect or obtain such information. Anything else? Bench line. Well, I think at this point in time, we can't say that there is any particular baseline. I think the 2019 coronavirus, for different people and different age groups, the incidence of side effects and mortalities are different. We need to have a detailed analysis regarding the efficacy and the possible side effects, and we have a further discussion, following that. We're still deliberating on this point, for the time being. At this moment, we have not laid down such a bench line yet. I think we would make reference of the HA's, incidence rate of a particular of the onset of a particular disease. Last question. Is there anyone who has yet to ask a question? Speaker not coming through. I'm afraid I'm not able to provide you with any information because I'm not on that panel. I believe that for the known adverse effects of the vaccines, we certainly monitor that. For the unknown side effects, we should also be monitoring on that as well. Are there anyone else who have not yet asked a question? If not, that's the end of our briefing. Sorry, Professor Hui. We learned earlier that vaccination can start at the end of February. Has that been postponed? Because you told us that the vaccine will only arrive at the end of February. So if there is a delay, why is it that before you have the full set of data, you are, approving the use of the vaccine in haste? And when the vaccines first arrived, Professor Yun said that he will not be the first batch of people who will be come forward for vaccination. Would two of you also offer yourself to vaccination? I understand. That's what I've heard from the Bureau, that the first batch will arrive in February. Upon arrival, of course, we have to make arrangements as to the venues at which vaccination can take place. Once the vaccines arrive, we certainly will get vaccinated ourselves. I think we have to wait for the, Food and Health Bureau to make arrangements for that. Thank you very much. That's the end of our briefing. Thank you.